like to welcome Dr. Satish Prasad Rath to share his thoughts on the topic care model innovations and evolving role of providers and patients. Dr. Rath is the Group Chief of Innovation and Research at Aster DM Healthcare, one of the unique comprehensive healthcare providers in GCC and India. He is a physician as well as a digital health scientist with multiple patents and publications. Recently, he has founded X Health Innovation Labs, India's first global digital healthcare and life sciences incubator and accelerator. In past, he has worked at Philips Labs, Intel Labs, and Xerox Labs. He is also visiting faculty at Telemedicine School of India and board member cum advisor at various incubators like MBX Capital, AI Ventures Australia, DERBI Foundation, etc. Dr. Rath, I would request you to please proceed with your session.
Thank you, Ilfa, and thanks, HitLab. It has been a like homecoming, so I have been involved with HitLab for some time, and thanks for this opportunity. The topic has been given to me is also quite interesting, and also this justifies my, I think, my passion, or you can say my madness to coming into this world. So as you said, I'm a doctor and a scientist, and why this is so much important. So doctors are there in terms of providers, and patients have got a lot of problem. But unfortunately, I think, as industrialization and other things proceeded, maybe innovations became separate from the providers and the patients. So that's where, I think the crux of the thing stays, and we need to actually rebuild it. If I will go, let's say, proceed with this what I call as my healthcare model, and which is applicable across the world. So we are born with certain equity, which is dependent on our genetics, which is dependent on our society, our education, and our societal factors. And as we grow till become adult, if we are completely healthy, maybe we are the most productive asset of a country or of a, of the world. But as we start aging, which is just a natural process, so our health, which is internal, starts declining, which is expected. But sometimes it takes a very big dip ahead of the time, or sometimes it gets a big dip due to some acute diseases, which we intend to solve by bringing it back with care interventions. So maybe this is where the interactions between the public and the provider come in. And if you see that purple arrow, which says that if the unhealthy path is the yellow curve and the healthy path is the green curve, the effort and the time and the resources which are taken to bring back a person from the yellow path to the green path is our healthcare intervention, or where all the things actually work out. If this is cheaper or affordable, then we say healthcare is affordable. If it is available, we say it is accessible. If it is bringing it back completely, then we say, okay, we had a complete remission or a complete cure. Now, this is where most of the investments are actually done. But unfortunately, the game of health is actually, or health intervention is around this. But somewhere I think, we have not actually focused much on this. And why is that? Is it that, we are not aware about it? We are definitely aware about it. So if you just go back, maybe 100 years back, when we had a stethoscope and we had a, little kit as doctors, we can see that, the doctors went to the patient's home, or the patient came to the doctor, and all the diagnosis, treatment, and consultation, everything happened in that one transaction. So the doctor felt the patient and then, diagnosed it, and then, they sent them back. But as industrialization happened post World War II, we had this, big machines, and these big machines neither could be taken to the patient's home, or, could be made part of, small clinics or GP clinics. So what it led to is, you had centralized systems which actually managed these big machines. And these big machines actually generated need of having technicians who are paramedical staff, or let's say engineering staff. And because this involved a lot of capital, it required also, for it to be sustainable, it required investment, finance. So we also needed a lot of managers. So now, we had technology, and thanks to these technologies like X-ray or the big machines or the diagnostic centers and all those things, it made our diagnosis much more easier and much more accurate. But in the same time, it also brought in a lot of other people who are good people, who are our friends. But the overall focus became on from treatment to how to make the healthcare business sustainable, and which is the right way of doing it. So mostly we moved away from getting closer to the patient, and there is a big gap which is there existing now between the patient and the provider, where there are a lot of intermediaries because the technology is actually not a point of care. So good part is now again technology is becoming point of care. And now we have things which can happen, which can do the entire from taking the symptoms to the diagnosis to the treatment to the intervention in a single setting with help of great silicon technologies to great AI technologies, great behavioral technology. So maybe again we are coming to this, but we very much saw this need to have point of care systems which is not extremely distributed, not extremely fragmented when COVID came up. And again, we woke up saying that, we have most of our technologies for the 2% to 5% of the sickest of the people. And for most of the people like us, who are outside the hospital, we have hardly any technology. We hardly have any interventions. We hardly have any innovations. And if we want to get to the bottom of it, why actually this happened, because larger part of our group, we are taking care of ourselves. There is no money there. If there is no money there, innovations has notoriously followed always something where money is there. So most of the expensive beds are the ICU beds, and very, predictably, most of the innovations are also there. But when we are now requiring, there should be a home test, there should be a home monitoring, there should be a psychological test, there should be a mental health support. We don't have any of those innovations present now. So COVID, I think somewhere I thank COVID to, make us wake up for this reality that we have been, practicing a fractured health, but we should be actually waking up. And in this effort, I think the providers should take the lead, because the problems are coming from the providers, the doctors and the communities and the patients. And they should actually raise the stuff that, I need this better than, I need the extreme tertiary care. So in this, it's not that, post industrialization, we have not done much. We have done a lot of stuff, but, most of the innovation has been focused on the big, busy hospitals, that too in tertiary to quaternary care. We kept on doing robotic surgeries to, let's say, identifying the genomics, to identifying, making things more and more layered as well as more and more complicated. But we all know that, we have still not reached that, what is physical, mental, and social, comprehensive health. But the good side of technology is we have started understanding the fundamental building blocks of our health, which is the biology. So now we understand that, our health model is from microbiome till the exomes. Thanks to the genomic sequencing as well as AI, a great example is the mRNA vaccines, which are coming in 10 months instead of, the old technology, which required 10 years. So that definitely, is there. But, all the technologies are requiring, specialized people to make them understand what are the benefits of genomics, what are the benefits of microbiome. So again, there are newer counselors who are, needed to make benefit of these technologies. Same way, I think, there is a lot of data which is available. Google published this, that, how just using and tracking the mobile data, we can actually know how the spread of the disease is happening. But we have archaic laws of, privacy, which are not actually sensitive for the citizens' need. And we are not able to, let's say, use them. Few good things have happened, few engineering enthusiasms have also happened. We heard about what happened in DeepMind, what happened with, Watson, or what happened with UBOT. But these are good starts. So I would want to say we have learned a lot about, wherever the mistakes have happened, but definitely, we are getting into the comprehensive side of the healthcare. So with this background, unfortunately, healthcare always has taken the, or has hijacked, something which is much more glamorous, something which is much more sexy. Whereas, mere smaller interventions like, health promotions, health educations, exercise, quitting smoking are actually, contributing much more to health outcome compared to the CABGs, or let's say the robotic surgeries or the strokes and everything. My point is not to say that, robotic surgeries and the cyber knives are not important. My point is not saying that, using advanced surgical techniques is not important. No, that is also important, but much more can be achieved by focusing on the non-glamorous or the non-sexy stuff also, which just can happen with citizen awareness, citizen education, smaller things. And more important is all the smaller things which was not happening at scale is now possible through an app. Now is possible through a AI powered chatbot, which is making it much more easy to reach out to people and much more effective to intervene, as well as much more effective to react. So I think we are now taking a holistic look where we have the robotic surgeries also, but also we have which are the technologies which can scale this non-sexy but much more important things of intervention. Just to take a stand, where do we stand? And I think we are definitely, we have a lot of way to go. EMR, better said, less said about EMR or HIS is the better it is. It's just an overhead on, I will simplify it. It's just an overhead on doctors. We don't enjoy it. We get burnout out of this, and it is definitely solving the problems of the accounting as well as keeping records and doing the compliance. But is it helping in patient outcome? Is it helping as a doctor to me to do a diagnosis much better? Is it reducing my errors? I'm doubtful about it. Few good things which have happened. Pharmacy took a long time. I don't understand why it has taken so long to get into retail, but good signs are again seen. But these all people have taken a long time to come to this far, whatever they have taken into. Lifestyle modification with pelotons and the Fitbits has seen a topsy-turvy path so far, but finally again we are seeing sustainable startups in this area. AI has started getting into the curriculum, and there has been some FDA approval algorithms on AI, so that's also a good part. A lot can be done with the bots, a lot can be done with a lab on a chip. We definitely felt the need of having a comprehensive lab on a chip kind of a solution for COVID. We still don't have a good home solutions for COVID, but still I think that's a big area of research what we should be really looking for. So definitely we have come a long way. We have come a long way understanding how technology is going, but definitely we have a long way to cover also. So little bit academic, but how we see innovation progressing. So this is my hypothesis: is innovation is getting encephalized. Encephalization is a field from evolution and anthropology, which says that as the humanity progresses or as any species progress, the cognitive function organ, which is our brain, the ratio of the brain to the rest of the body is actually increasing day by day, and that's a natural evolution. So same way, I think AI, software, cognitive computing, quantum computing are going to slowly take a larger role in deciding the nimbleness of an organization or in deciding a medical device or a medical solution to be decided. So in future, it is just natural and normal that software will be taking an upper hand of controlling the big mechatronics systems of medical innovations, and that's what is happening. So also is expected that the startups should be coming out with solutions much more faster compared to, let's say, the big giants like the GEs or the Siemens or the Philips or the Medtronic, and this is just natural. If we are aware about this process, I think we can sustain. If you're not aware about this process, or we decide not to go about this process or choose this path, maybe we have difficulties ahead. So based on this, this is my prescription, if you can say so, is if you are an innovator, if you are innovating, it's very important to combine the biological stack. You need to understand the full stack, from microbiome till the transcriptome to the exomes to the external exomes, and then apply AI on top of it. If you are only an AI company without knowing the biological stack, it's going to be difficult for you to sustain. In same way, if you are a biological scientist and you are not having the proper understanding or proper partnership with an AI firm, it is also going to be non-sustainable. So that would be my typical part of it. The more important is more data it is there, more it is easier for AIs to, let's say, predict things with good specificity and sensitivity. And for this, I think we have always ignored the citizen data. Why we have ignored the citizen data, and there has been a lot of bottleneck of using it in an anonymized form. I somewhere feel the power stays with countries which are very populous like India and China, because it has got a lot of citizens, which means if all the citizen data are curated, this has got a huge amount of a data bank opportunity. what we can look for: personalized medicines, personalized therapies, personalized interventions, which is the need of the hour. And all this can be done only with good amount of data. So it is time for countries like India and China and the other populous country to, leverage this, strength or the good part what they have, and come out with regulatory laws which are going to be conducive for it, which can actually bring in a lot of startups in the long run. Same way, if I go for the enablers, right? What people like, let's say, the providers should do. Providers should act as the role of an enabler. So they have got a lot of data within themselves. They can actually create what I call as a data bank or a center of digital health excellence, which can actually be the fertile bank or the fertile bed for startups to start working in. I'm not against partnership with big firms, but what you will see is what we have built as a reaction to this is, you can partner with big companies to small companies, but providers should take the leadership of coming forward and providing this fertile ground for innovation. What I mean as a result of that is, what we are building at Aster is Aster Center of Digital Health Excellence. I think interestingly, we have started this 1 year back, and just recently FDA announced a model or a template or a necessity for having a Center of Digital Health Excellence, because this is very much needed. You need collaboration. So we are having something what is called Aster Data Bank, which constitutes the genomics data to the diagnostic data to the citizen data to the EMR data to the radiology data to all kind of data, which is getting stored at a stage which is anonymized, which is structured, which is longitudinally processed, so that it is available for simulation. That's what we call as clinical simulation lab. We have a lot of partners. You can see that we have academic partners, we have big companies who are also our partners, as well as we have a lot of startups which are our partners. We do have a biological research center, and I purposefully put it as biological research center because medical research always is confused with clinical trials. What hospitals are doing, they're doing less of genomic research or metabolomic research or sepsis research. So we have a dedicated biological research unit which is working with various other universities internationally as well as locally to do this fundamental research. We already have a few patents on on insulin, on COVID, on monoclonal antibodies, and this is very much needed. The point I want to stress is this initiative has to start from the fertile ground, which is a provider. So, and what is Excel Innovation Lab? Because we cannot do it just by ourselves. So the strength what we have is we see 20 million patients. We see across primary care to secondary care to tertiary care to quaternary care. We are present in 9 countries. We are a huge organization. This is a problem for us to manage because this is a very, very big organization to manage. But the strength what we see out of this is I am converting this to a clinical simulation lab or a center of digital health excellence where we are collating the data. Along with the data, we have wonderful doctors, we have wonderful nurses, we have wonderful healthcare workers, and these actually become our invention backdrop. So we are actually providing this as a platform for innovation, where Excel Innovation Lab is a external looking, I can say very proudly that, one of the its own kind global digital health incubator where we incubate and accelerate life sciences firms as well as, digital health firms, which are the problems which are defined by us. And the problem is actually coming from the frontline healthcare workers. So that's where, it's not the startup which are going to work for something and whether we are going to like it or not. It's the other way around where we are coming up with the problem. These are the problems what we are facing in day-to-day life, and we want this to be solved. So we are coming out with themes, and then startups we are matching for them. So it is actually become very, very important for them. One more key part of Excel Innovation Lab is it involves a hospital immersion program where the startup can get their concepts validated through our doctors, through our hospital staffs. When they have their early prototype, they can test it inside the hospital. So this is not a PowerPoint testing, or this is not just a imaginary testing, or this is just not testing without the statistical significance. So if it is a robotic implant, it should be tested with the relevant stakeholders. If it is a population health study, it should be tested with the relevant number of people with the relevant number of data. So we provide you the real world evidence whether your startup should be working or what insights you should be having, so that you are going to be sustainable in the long run. On the other side, we are also one of the few labs which is providing the deep biological research, from microbiome to genome to exome. And this is, leveraging the Indian ecosystem. That's what we call as a Aster Digital Health Incubator, which we are working with government as well as the local ecosystem. Whereas XHealth is something which is a global, incubator and accelerator. So this is what I feel is there is a big responsibility, also a very big opportunity of providers, how to convert their problems into a fertile ground in an open innovation manner, so that everybody wins in the long term. Thank you.
Thank you so much, Dr. Rath. It was really great to hear your uh, thoughts and insights. There are a couple of questions. Number
Sure.
one is somebody has asked, considering the massive diversity and huge population of India,
Yeah.
instilling any change at the primary healthcare can be challenging. What are some of the few areas that we can touch upon?
That's a very good question. Let's say we have around 7 to 8 startups which are looking at population health at the primary care level. You know, anytime when a startup wants to work with a hospital, they always look for a Apollo or a Medanta or somebody equivalent, which is convenient. There is nothing wrong working with them, but we should be really aware that these are only tertiary to quaternary care centers. They are not primary care centers. If your problem is at the primary care level, you have to work with a primary care provider. Luckily we are a primary care provider. We are a large provider actually in UAE and Dubai and the entire GCC countries. So we actually first, team them to work with the primary care system, so they can come and work here. As well as we have a big field called Aster volunteers who work with the government units of primary care, especially on the CSR activities. So first part is define the problem, meet the real stakeholders. You cannot solve a primary care problem by going to a quaternary care hospitals. And then, you can always log into our website, understand the, let's say, immersion model, how it works. And after that, test it, test it, test it. All I would say is, the more you test it, the more sooner you test it, the more in the real environment you test it, you'll be getting your real insights. So insight is just not whether your algorithm is working or not. The much more important is whether your doctors and users are liking it or not, which is the usability testing, what we call. And finally, but not definitely the least, is the business modeling, let's say, testing. So we help you with your clinical testing, with your usability testing, and much more important is with your business model testing.
Thank you. And the next question is, so irrespective of the surge in cases in Delhi, the government and providers have been able to manage the pandemic quite effectively. How can private entities, including hospitals, contribute for better management of crisis?
I might differ a little bit. I don't agree that we have managed it well. If you say that not doing enough tests is actually managing it well, we have not managed. In fact, the entire world has not managed it well, because the virus has not gone anywhere, and the transmitters like us, we have also not been very disciplined. So I feel here this is a very good question. So I think hospitals should step up, just not to see as how many beds are having ventilators and how many tertiary care or the end of life support we can give. We should be playing actually important, let's say, role in also in the prevention part, as well as providing home testing as well as home quarantine services. I think hospitals have failed there. What at Aster we are doing is we are doing a very unique stuff. So in test, actually there is a concept called pooled of test. So government do not have a lot of money, neither they can, even when government says that you do free test, that's also not sustainable for us. So we have done a very unique stuff where we can take the entire apartment or the entire community and we do pool. So let's say we collect 1,000 samples, and the pool actually suggests us which are the subgroups of positive cases. So out of 1,000 we end up doing test only for, let's say, 10 or let's say 100. So at a cost of 100 tests, you can actually do 1,000 tests. So that is something which is a very innovative way. We are working with Government of India for this part, as well as various state governments, so that we can actually provide this rapid and comprehensive and complete testing On the other side, we have our home healthcare services where we are also providing them home quarantine service. And the last but not the least, we are also providing the panic attacks and the anxiety attacks, which is there with a lot of people after COVID with our innovative app program called Serenity. So we are taking care of this in a very comprehensive way.